Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. Cece, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Anna Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health.
Welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. Cece, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama, and our co-host.
I'm Anna Kate, your medical mystery overachiever and discovery liaison, and we are back with another mini-sode, and we are going to talk about eczema today.
Yes, I love this topic because I just want y'all to know that there is always something that can be done. And I've gotten this huge influx of especially babies with really severe eczema. And I mean like ooey, oozing, gaping, just yellow, pussy, itchy eczema all over in the past year. Really, it's been so much more prevalent. I also get adults with it too. But the amount of babies that I've had with that severe of eczema has just exploded. And I often don't get the kid until they've been going through it and suffering for a couple months and they're on steroid creams or doing oral steroids or even offered immunosuppressants at 2 years old. Yes, I had a 2-year-old the other day who came to us for the first time, and their PCP or their primary care doctor wanted to put them on a very intensive immunosuppressant because the kid is so uncomfortable with just itching, and it's impacting their development and their behavior. And they're just either as an adult or as a parent, there is always something more that can be done on the functional side. And that's what I want to talk about. Because I just feel like so many people lose hope in that situation. And it's a downward spiral very quickly, especially when you're dealing with a baby, because then you're scared of giving them foods and they're reacting to everything and you don't know what they're reacting to. And so it inhibits their ability to just move forward and grow and thrive and eat and drink. And it's a very tough place for new parents, especially.
Poor babies.
I know. So the biggest part if a patient comes to me with eczema is to find out why. Find out why.
So I've heard it explained this way, that eczema, or not just eczema, but typically things that end up on the skin, it's the last red flag of something else that's going on inside, and we need to take care of what's going inside, and the skin will resolve itself.
Yes.
Okay.
So there are few instances where skin things, no, I'm not going to go down that. There's a lot of skin things that are just skin things.
Yeah.
But if we're talking about like atopic dermatitis, if we're talking about I touch something and I have an allergic reaction to that thing that I touch, that is a very distinct, outwardly
like poison ivy.
Yes, exactly.
We're not talking about that kind of skin stuff. Okay.
Eczema on the more chronic front always comes from internally. Our skin is our biggest organ. So yes, by the time that our skin is showing us information when it comes to something like eczema, it means that something's been brewing on the inside. And I say this, and it's a very layman's way of saying it to patients, but I'm like, okay, if your skin looks like this, imagine what's going on the inside. Right? That's producing that symptom. So conventional medicine will take that eczema baby and use topical steroids, or even if they're itching and becomes infected, then we have to have antibiotics, and then we go to oral steroids, and there's that protocol, right? And that will work to decrease the severity as long as a patient is on that regimen.
Right.
But they can't
be on steroids forever.
Right. And and it's a baby. Who do you like babies on steroids? Just
which is not like having 10 babies that are just having a wild time, like babies on steroids.
Right.
But having one baby on steroids is not
corticosteroids.
Right. There are other options.
Yes. And that just is masking what's happening. And a question I challenge parents with is, okay, if that steroid is providing relief in that moment, what is a steroid doing? A steroid is suppressing an immune response.
Right.
So that is why it's having an impact. So what do we need to do? We need to go find what the immune system is responding to. So eczema in general, the main things I look at: 1, gut health; 2, histamine levels. Eczema is a byproduct of too much histamine. So we have these white blood cells called eosinophils. And these eosinophils, they respond to things like allergens or parasites or candida or whatever it might be, and just allergens in general. In all eczema patients, I see that eosinophil number, which is a percentage of white blood cells that should be about 1 to 3%. And every single eczema patient, I will see that eosinophil number elevated, high. Sometimes it can be 11%. Sometimes I'll see it up at like 25%, which means that 25% of your white blood cells
fire
are those eosinophils, right? I will also see something called immunoglobulin E, or IgE, that is elevated in those kids or adults. So that is, I use that as a marker to then know that the system is decreasing over time and chilling out over time. It doesn't give me an answer. I already know that. I'm already expecting that. But it's a good way to tell me that over time things are working and settling down.
Yeah.
So I use that as a marker. Then the question is, okay, what's provoking them? And that is where I start with the GI tract. Why? Because we digest histamine in the GI tract. We break it down there. So
imagine that.
Yeah. So if there's anything going on, if you're dysbiotic in any way within the GI tract and you're having trouble simply just breaking down histamine there, then it can accumulate and cause that threshold to be elevated, where now we're more reactive to everyday things in life, like foods, like inhalants, like environmental allergens.
And when you have one and you pile on others, the other things that may not have been such a histamine reaction are higher because you're putting it on top of all the other things that are happening.
It's like the little cherry on top. Yeah. And the other part is you can actually have things going on in the GI tract that are causing those eosinophils to be elevated. Candida is a big one. Parasites are a big one.
Yep.
So then we move more systemic into the blood, and I look for things that I look for in the GI tract, also in the blood, because sometimes it can be completely negative in the GI tract, and then I'll find them positive in the blood.
Right.
The biggest culprits I will see are mold, fungus, candida exposure, or mold exposure. That is massive, especially in babies right now. I'm seeing it just across the board, just little fungal balls. I know, or candida in the blood, or certain parasites. And then I never see food being the only trigger. It's very rare. Food is like, well, obviously we can have allergens or allergies to food and reactivities to food. And that's often where parents will focus on.
Right.
Because if you're trying to introduce foods to a new baby or to a baby and they're reacting to everything, that is the most like readily available observation.
Yeah.
And so they'll start pulling out all these foods, which is great, but no baby is just born allergic to every single thing on the planet. And so what I explain to parents is I'm like, okay, hey, this is for now. We do have to take out those foods that your baby is clearly reactive to. And sometimes I'll even look at food allergens and things like that, so the parents know what to take out definitively. But that's not the only culprit.
Right.
The only culprit, or the culprit, is deeper. And then that kid is just so reactive because of all that histamine buildup that now when we eat that blueberry, we break out in hives.
Right.
So it is all about digging to find what is your trigger and why is your threshold for that histamine so high. And while I'm figuring that out, I bring down that threshold. Okay. So I use conventional and more holistic medicine to bring down that threshold, because oftentimes just good old-fashioned antihistamines aren't good enough.
Right.
Because we have these things called mast cells, and when mast cells break apart, they produce histamine. So antihistamines are like little Pac-Men that can come in and eat all the histamine. But if the precursors, those mast cells are producing too much histamine, then those antihistamines can't keep up.
Yeah.
So sometimes I have to go to more conventional medicine to use mast cell stabilizers in the meantime to help tell the parents to sit down while doing more natural antihistamine and a little bit of gut work while we're doing labs to figure it out. And I've had so much success with eczema babies, just staying patient and looking outside the box. And I'm giving these very general guidelines to commonalities I've seen between eczema patients, but at the end of the day, every single eczema patient is different. It's just what is their trigger.
Right.
That and providing these babies relief. And the thing that it like eats my heart up, because by the time I get them, they are so severe that I love when these parents can come back to me in a month and be like, we've had so much less itching and we can now tolerate leftovers and we've introduced this food and we're able to take the gloves off. But it is such a long road because then you have to go and heal the skin, and they've just been through so much that part breaks my heart. Yeah. But I just want adults or parents with kids with eczema, there's always something that can be done. And if your heart is telling you that this is not right, that there's something more out there, then please go seek it, because I promise you, like, I love when I get eczema babies. I tell my nurse Heidi this all the time, and they'll be so severe, and I'll be like, yes, there's eczema baby, because it's very straightforward.
You can do something about it.
Yes. Yeah.
So it's a no-brainer of we know what to do with this, and we can do something with it. It's going to take time.
Yes.
Because it does take the body takes time to heal and replace those cells. And what is it? You get every cell in your body's replaced every 7 years. Mm-hmm. So, I mean, not that eczema takes 7 years to
but it's the point that you get rid of all the yuckies, you get rid of all the stuff causing it, and then you do have to do work to heal the gut, to heal the cells so that it doesn't come back, right? It doesn't flare back. And that does take time. Yes. And I absolutely understand this, but by the time patients come to me, parents have been put through the ringer, and they're so sleep deprived, and they're so just sad for their kid that patience runs out.
Right.
And that's the toughest. That's the only hard part for me to deal with.
And then you catch that of I'm just so exacerbated. One more thing, I just want an answer. And it's not necessarily just getting the answer, it's also getting the relief.
Yes. Yeah. Exactly.
That's what we're all searching for. And that's a chronic illness kind of theme. Going through things of just and getting to the place where they end up in your office it's important that they're there, but it's also like, I want a pill to make it work. And
because they're just so frustrated at that point. And the eczema part of this is very similar to anyone who has been diagnosed or suffering from mast cell. Mast cell syndrome is a very blanket term, again, for just your immune system being overreactive in terms of histamine. I had a patient a couple of years ago who couldn't walk by a swimming pool without breaking out in complete hives. Because of chlorine. I had another patient who couldn't shower. I mean, she did shower, but every water would make her break out in complete hives. And it didn't, and I know your brain goes to, okay, what toxins in the water or whatever. It didn't matter. She had whole house filters. It didn't matter whose house she was at. And her own sweat would make her break out in hives. Yes. True mast cell, like chemical sensitivities, etc. It is all just about finding the trigger. And in the meantime, reducing that mast cell response, reducing that histamine response, taking away any triggers that we can for the meantime, any known triggers, and then figuring out what the heck is going on underneath. And there's always, 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 usually a couple culprits, but there's always a culprit.
Good. And we can go attack and make it happen.
Yes. We can get her done.
Attack in a very good way. So I learned something about eczema. How about you?
Yeah.
Did you learn something about this?
That is all I wanted to say. I hope just it gives you, if anyone's listening to this, please know that there's something that you can do. I promise you, there's always more that can be done. And my heart just breaks for the little babies and the parents that feel like there is nothing, and then they suffer for so many months.
There's hope and help.
Yeah. So that's all I got.
All right.
Stay tuned for some more of our fun little mini-sodes. Anna Kate's going to love these next two. These were her request. So,
oh, goody. Good.
Stay tuned as we dive deeper into some of these quick little categories for y'all. And until next time,
let's discover together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, if you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together.
The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The hosts, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.